Hi, my name is Dr. Erin Sterenson. I'm a psychosomatic medicine fellow at the Mayo Clinic in Rochester, Minnesota. I have a particular interest in the interface between endocrinology and psychiatry, and I focus on type 1 diabetics with mood disorders and eating disorders. I've come to the APA to do a presentation particularly on the comorbidity of eating disorders and type 1 diabetes. There are a number of comorbidities seen in type 1 diabetes, and we often screen for the macrovascular and microvascular complications throughout the lifespan. But looking at the research, a number of these complications are often not seen in our patients until 10, 20, even 40 years after diagnosis. In contrast, eating disorders are actually quite common in our type 1 diabetic populations in adolescence and early adulthood, particularly in women. In fact, it's thought that women with diabetes between ages 15 and 30 are 2 to 4 times more likely to develop an eating disorder or to engage in eating disordered behaviors than are their non-diabetic cohorts. So these patients not only engage in behaviors common to anorexia nervosa and bulimia nervosa, but they have a unique way of purging calories from their bodies through insulin omission or underdosing. Studies suggest that approximately 9 to 40% of women between ages 15 and 30 actually engage in this behavior to control their weight. As you might expect, that there's a number of complications that come from this comorbidity. First of all, we have difficulty in screening for eating disorders in diabetes. First of all, the general screening tools for eating disorders often ask questions that most of our patients with diabetes are encouraged to incorporate into their daily life, being aware of carbohydrate content, being aware of calorie content, avoiding foods with sugar in them. So sometimes patients without eating disorders may be diagnosed with eating disorders simply because they are adequately controlling their diabetes. On the other hand, these screening measures don't screen for insulin omission or underdosing, which is the most common form of eating disorder behavior in our diabetic patients. It's important to recognize that eating disorders in diabetes are have significant complications even in subclinical syndromes, some that we might not diagnose or even treat in our non-diabetic populations. Some studies suggest that these patients are 3 times more likely to develop retinopathy, and in fact 3 times more likely to die as a result of this comorbidity. So because of these complications, it's very important that we develop ways to accurately screen for and treat eating disorders in our diabetic population.